My dear students, welcome to today's class on R.A.T.S for exam. This is an extremely important class exclusively for the exam going students. And the part 1, as you people see, is restricted to the theory part of it. Welcome to today's class. In this class, I shall be discussing the pattern of examination and the theory components for the MD examination. And please note, this is only for the exam going postgraduates. Before I plunge into the topic, I would like you people to kindly stare at the picture in front of you. A very beautiful cartoon that I had downloaded from the net thanks to Alami. This is a story of knowledge and wisdom. Both were very great friends, and once they met at a party, and knowledge asked wisdom, "Do you know how much I know?" Wisdom thought for a second and then said, "Do you know how much I do not know?" So what we do not know is the important message for the day. The contents of today's class will be the following subheadings or topics, whatever you people might call. I'm not going to read this, but I would like you people to kindly spend a few seconds going through this. You can stop, you can rewind, but this is worth going through. There is the theory, there is a practical, what are the criteria for passing, the mark distribution, etc. The course all of us are aware of. But for you people, there are certain highlights. All of us know that it is for 3 years, for a period of about 36 months, at the end of which the examination is being conducted. There are 4 theory papers and 2 days of practical examination. You might consider yourself lucky if you get a day or 2 break in between. And apart from this, there will be the viva voce and pedagogy. These are the various components of the examination. Now, look at this particular slide carefully. There are 4 different papers: general pathology, systemic pathology, general medical and surgical pathology, including applied aspects, and recent advances in immunopathology, hematology, and laboratory techniques. These have been worded so and arranged according to the guidelines provided by the Medical Council of India and then the National Medical Commission. It is a dictum that recent advances, immunopathology, etc. should be there, and therefore they have found a place somewhere. What we students should be very careful about is, look at this asterisk marks, can cut across. The questions can cut across the various papers. Recently, to our dismay and surprise, we found that a lot of questions from applied pathology and recent advances were asked in all the 4 papers. Imagine the plight of the student. So kindly be prepared for it. Do not read for that paper the previous day. The mark distribution. All of you know about it. It is again a kind of a revision. The theory, overall it is 400. of which the student should score 50%. And then there should be a minimum of 40% per paper. This is again an important lesson for the examiners like me. So even if we are lenient, we should take care to see that the student gets at least 40% in a paper, and then it is compensated by the others, such that overall there is a 50%. These are the practical distributions we shall be seeing later on. And the grand total, again, you will have to get 50%. I shall go into the practical details at a later date. But an independent pass in the theory and the practical examination is mandatory. Now, why should I talk about all this? As a student, you are asking me, should I read everything? The answer is yes and no. Rather, this is a very important dictum that you people should try to apply in your revision. It is better to know something about everything rather than everything about something. There are 4 papers, maybe essay questions will be there, and lot of short notes will be there. Even if a student misses a couple of short notes, it is difficult for that student to pass. Whereas another student who is average but attempts all the questions more or less uniformly will be able to sail through. So the very important underline for today's classes, you should know something about everything rather than everything about something. These are not my words. Please go to Robbins and ask him. And always there is a probability. Whenever there is something that is hurting, there will be something that is encouraging also. This is my understanding. 90% of the questions will be repeated. 5% might be from the recent techniques, advances, or developments. And 5% may be totally illogical, unexpected, or out of context. So 90% is repeated. Always this 10% is supposed to differentiate the varying students. On the contrary, if it is going to be like this, 10% is expected and 90% is unexpected, there is a chance that the paper might be reviewed and the exam cancelled. What do you see in this picture? An art of balancing, almost analogous to the previous statement that I had made, knowing something about everything. And therefore, you people should balance. In the sense, you should know to almost the same extent systemic pathology, recent advances, haematology, general pathology, applied pathology and immunology, and there has to be a balance of all this. Do not develop a passion for one particular unit. Do extraordinarily well in systemic path, slides, and biopsies, and pathetically in general pathology. Immunology, all of us are averse to, and hematology is a little abstract. Recent advances, we cannot understand at all. But still, we will have to balance all this, and that is the art of balancing as far as the exam is concerned. Now, there are too many pathways. If you people kindly go to the library, you find that the maximum number of books in a subject will belong to pathology. Too many monograms, too many journals, too many reference books, and we intrude into almost every subject. Take oncopathology, for example, hematology, for example. The list is too long. But my question is, Today you are a student. Tomorrow you are going to become a faculty and you are going to become an examiner. What are the questions that you will be asking? Simple, straightforward, logical. Those will be the questions that you will get. So kindly be very sure about the questions. If you know the question, you are an excellent student. Leave alone the answer. And you must define and delineate the book from which you are reading. Robbins, for example, worldwide, accepted. If there is something else that is recommended in your center, kindly follow it and stick to it. Manage the time that is being given. And the questions that have been asked, I'll be giving you the sample of it later on. And common sense is always more important than extraordinary knowledge. What is the molecular basis of neuropathology? If the student is not answering, he or she might not be failed. But if the student omits a question on anemia or aneurysm or pneumonia, there is very little chance that the student will pass. So it is basic common sense. And this I call the art of being practical. So you people should be practical and realistic. So look at this one, a wonderful saying that I managed to pick up. Your direction is more important than your speed. Once you choose the wrong direction, however fast we go, we might not reach the destination. And if you are allowed to come back and then again revert to another area, it is going to consume time, energy, which is not worth it. Again, a question for you people. How much should I write? How do you people calculate this? I've done a little bit of calculation for you people. The total marks per paper is 100. And you are given a time of 3 hours. That is 180 minutes. Therefore, the number of minutes per mark will be 1.8 minutes. If it is going to be a 10-mark question, you should allot 18 marks for it, 18 minutes for it. If it is going to be a 20-mark question, 36 minutes. 15-mark, 27 minutes. This is a rough calculation. Now, why am I going into this? It is not uncommon that, and here again, time is a factor. Always my logo is also R.A.T.S, racing against time. Let us go to this one. We have seen questions like this. Short notes, 1, tuberculosis, 10 marks. How much can a student write? Always when we tend to write an answer too very well, it is at the cost of other questions. And we do not know how to limit, what to write, what not to write. And there will also be an essay like this, interpretation of renal biopsies, which is again very extensive, but the mark is just this. So if this is going to be the question, tuberculosis, it should not be for more than 18 minutes. And if it is going to be the second one, it should not be more than 27 minutes. Because I have calculated it based on the marks and the time available. Look at the screen. 2 important contrary quotes of experience. I used to literally torture my students with this. The question that you omit is your university question. Similarly, the question or answer that you read at the nth hour is unlikely to be asked in your paper. All of you will agree with me. You people have written so many exams, and this is a reality. In fact, our performance is based on what we have read until now, rather than what we are going to read anew. There are some major blunders that we make. UG questions are not for PGs. I shall show you the PG paper. And always we tend to emphasize too much on neoplasia. The latest classification of tumors we all should have at our fingertips. Tell me whether it is really possible. For the second year students, by the time you write your examination, the classification will change. So much of advance. So we are not going to take the onus of responsibility for the changing classification. It is their headache. We shall be strong in our basics. Weightage. Do you people know the meaning of the word weightage? It is supposed to be the mark allotment for each section. Generally, a good paper and a good paper setter should have a uniform distribution of marks. It can be done chapter-wise or section-wise, etc. Sometimes we find that there are too many questions from the female genital tract, male genital tract, and kidney, whereas there is literally no question from CVS R.S. So this has to be somehow balanced. But there will be a problem. Sometimes it happens the other way around. The same question is asked in paper 1 and paper 2 also. SLE. That is because different people will be setting the different papers, and they also, when they are going to set it, they do not vet it or analyze it thoroughly. Unfortunately, the victim or the benefactor is the student. And personally, I feel that this is a good formula for you people to follow. MK, D2K, N2K. MK means must know. D2K is desirable to know. N2K is nice to know. For example, myocardial infarction. It is a must know question for me. Spread of tumors, must know. Desirable to know, effects in phagocytosis. Nice to know, what is the molecular basis of acute tubular necrosis? So, always you find that there are some nice to know questions which you can simply ignore. Just go through it, write whatever that comes to your mind, put the heading and the number correctly. Neither you nor the examiner will be known. And a paper setter should have the questions like this. There should be straightforward questions. There should be certain analytical questions. Sometimes I see that the papers have got problem-based questions for the postgraduates also. There can be comparative, different types of emphysema, for example. Etiopathological, pathogenesis of megaloblastic anemia. Diagnostic, interpretation of biopsies. Recent advances, serrated lesions of the intestine. Applied, electron microscopy or immunofluorescence. Interpretation again. So it can be like this. The questions can be in various formats, and you people should be prepared for the juggle that is there or the jigsaw. In fact, you can practice it. Once you keep doing it, you yourself can set wonderful papers like this. But the balance is the key. After all, we are all human beings and our memory is short. There are two types of memory. One is called a short-term memory, another is a long-term memory. Sometimes you forget what has happened today, whereas you recollect what has happened a few years back, and what you have learned in your childhood, it is still there in your mind. That is because of a constant act of repetition. Because of repetition, you find that what is initially a short-term memory gets converted to a long-term memory, and it remains as it is. These are important things that you people should have in mind. Read and forget. recite, try to read aloud, try to recall what you have read. Realigning and reference, maybe not at this particular time of the course, just before the exam. Review, try to remember and then reproduce. These are the things. Initially, it might consume a lot of time. The reading, reciting, and the recalling. This might consume a lot of time, but you find that this will hardly consume 10% of that initial time. So as you people keep on repeating, speed will come to you automatically. Why I am saying this? For example, a flow diagram. Look at this one. It is a little complex. It is not very easy for everyone to just decipher and track a flow diagram. So this can be done only by repeated practice. You can even scribble here and there. Try to talk to yourself so that the ears also hear. So it is an auditory stimulus. It is not a kind of understanding that is important now. Whether I understand or not, I should be able to write. Balancing is an art. I had given you the examples earlier also. I hope you people appreciate this picture. And when I say balancing, you people should know the various components of it. So it can be UG questions, PG questions, how the marks are being distributed, what is an essay question, what is the technology that is being asked as a question for us. You need not master the technology. My sheer ambition is to write the answer. What is the volume I should write? Variants, for example. There are certain questions where variants matter. What are the variants of osteogenic sarcoma? Flow diagram. I had given you an example. There can be columns which you will have to mention. Nephrotic syndrome is one good example. Polycystic kidney is another example. Line diagrams. Always choose line diagrams. Please do not draw any histological diagrams. It is absurd. It is not worth it. And you will have to enlist various things. I'll give you again examples. Recent advances, there is a catch in it. It is voluminous. It is a study of some experts in that particular field. And today, these are being incorporated into the text. So kindly mark the recent advance in your text as RA. And then when you read it, it will get registered. Because definitely recent advances are going to be an important component of your question paper. There are some quotes to remember. No? This is something that I do not know from where I picked up, but I had written it in my own book. More than possessing a book, knowing what it contains really matters. And it is better to understand a little about everything rather than everything about something. So these are important things. This is actually a quote from Robinson. And there are a list of books which, again, I repeat, I emphasize, kindly do not change your book. Robbins is one, Ackerman, Surgical Pathology, or it can be Sternberg or Fletcher, any other book. Monograms you can use only for reference of any specific topic, otherwise not required. For hematology, it can be Hoffman, and then a reinforcement with Kautalkar or Tejinder Singh as a revision. And what is a good book? Any book that has stood the test of time is a good book. So please do not change your book. By this time, you are the best judge and you are very familiar. In fact, read from your own Robbins rather than from your friend's Robbins. Nowadays, students are downloading the books and then reading. It is a very bad habit. You should be familiar with the pages. You should know the weight of the book. You should know the feel of the page. And there are some conferences which have been particularly informative, where they deal with the giant cell lesions of the bone or the immunohistochemistry, interpretation of muscle biopsy, etc. These are all given by experts. And if you have got notes of them, kindly take that down. Do not prepare other notes. Your textbook is more than enough. But for such things alone, you people prepare, and that will be an important yardstick for your examination. Now, look at this slide again carefully. This was a pattern that I followed as a postgraduate student. Even for undergraduation, I had followed this. In fact, this was deciphered by Dr. Rajendran and me when we were students at Taramani, Institute of Basic Medical Sciences. And look at each line of this. Complete set of undergraduate questions for a period of 10 to 15 years. Complete is a word. Do not omit 3 or 4 years and then take another set, because that continuity is important. So also the postgraduate questions, as many years as possible. 10 years, if it is going to be 15 years, good. It can be from any one university, preferably 2 universities. It can be the MGR Medical University, or it can be from Maharashtra or Andhra Pradesh, or it can be from any of the new universities that have come up. It can be from JIPMER or AIMS, etc. But it should be in continuity. And then compile these questions chapter-wise. This should have been done earlier. You people already would have done. Even otherwise, it is not too late. Just mark it in your book as essay, short note, whatever it is. The topics in recent advances, again, you will have to label in your book as RA. That is because even the recent advances would have been covered in Robbins, but in a very concise manner. But our idea is to attempt it when it comes as a question. Theories of atherosclerosis. This was a recent advanced topic those days. But then we used to mark it, read it up from Robbins. Early gastric carcinoma, one of the topics in the then recent advances. Mark it in Robbins and then read. Or any of the surgical pathology. Any specific topic from reference books. I had given you a few examples. And topics presented by experts in various conferences. So these you people should be marking. And look at this one very carefully. I had mentioned only the questions, nothing about the answer. So these should be the questions and the pattern that you people should follow so that we do not omit anything. So only questions. And this we had mentioned earlier. Stick to one book. You revise as many times as possible, and the review will be consuming less time. What do I say? Or what do I mean by this word revise or read? What is it going to matter? See this one. I mentioned it is from the text only. The predisposing conditions for infective endocarditis include, and there are a list of things. Obviously, I don't think Robbins or anybody will be numbering it and giving it to you. But as a student, your first responsibility should be this. The same thing, and I have numbered it, and there are so many predisposing conditions. Of which, if you people answer 60% of the causes or conditions, you are a good student. If you answer 65%, you are excellent. More than 65%, you are outstanding. If you answer 100%, that means you have copied. So it is not humanly possible for us to recollect and reproduce everything. That is the message in this slide. But then numbering is a very good habit that will make our mind get stimulated. Now, there are some definite ways of improving our answers, the presentations. Always follow a sequence and the subheadings. definitions, classification, differences, differential diagnosis, flow diagram. Like this, there are many things. You people should be able to mention that and draw diagrams wherever is possible. This kind of a sequential presentation will make your paper stand apart from the others. Also, try to answer your question paper in the same numerical order. Do not be jumping. Question 3, after which you write question number 9, coming back to question 2, because the examiner will have to search for your answers. And when some topics are complex, try to prepare for that earlier. The differential diagnosis of different kinds of cirrhosis, jaundice, for example. And as I told you earlier, stick to one source. Whatever be your preparation, it should be preferably from a single source. As I mentioned earlier, you see here, if you cannot hear others, hear yourself. Speak, narrate, and then you write. This should be the mode of preparation and writing. There are certain observations. Students must be good in all sections. Teachers are vindictive. Passing is a matter of prestige. Intelligent students do better. We all must be up to date with the recent advances. Undergraduate questions are not for postgraduates. Neoplasia will carry more marks. These are some observations which I had seen run in the mind of the students. The actual reality will be something like this. Students must be good in all the sections. Not possible. Teachers are vindictive. Never. Passing is a matter of prestige. This is not a fair expectation. Then we cannot conduct exams at all. Intelligent students do better. This is not really the case. We must be up to date in recent advances in molecular pathology. Absurd. UG questions are not for PGs. It's a great mistake. And neoplasia will be carrying more marks. It is a wrong notion. Look at this question paper, for example, and this is from the Tata Memorial Center. Different centers will be having different patterns of questions. Here, the questions are a little more advanced and more practically applicable. Whereas, if you are a student of a teaching hospital, it will be more theory-based in general pathology, hematology, etc. But still, there are some questions like this. Discuss the laboratory investigation in a case of bleeding disorder. This is one example where a prepared answer will be much better than a read answer. You people will have to prepare these. And certain things like umbilical cord blood banking. When you read the entire book as such, your answer might not be as good as when you prepare this particular question. Always, a student who prepares question-wise answers better. He might not be knowing the subject better. That is not our botheration. We should write better, get better marks. So this is a couple of examples. That is why I say go through the question papers. And whenever you answer, these should be the subheadings. There are various subheadings. Kindly go through this one. I always say, think of the subheadings. The subheadings will take you to the answer. I had a friend of mine who used to write all the headings first, and then he will try to track the answer. And please do remember, all are not applicable to all the questions as such. There is something called pathogenesis of megaloblastic anemia or pernicious anemia. There is not much pathogenesis in an iron deficiency anemia. Predisposing conditions you can find in a case of neoplasia, precancerous lesions, and so on. Whereas you will not be having predisposing conditions for spherocytosis. So the wording is important. Accordingly, you people should prepare. Pathogenesis. Again, bronchial asthma is one. Classification. So each one of this, morphological one, renal cell carcinoma, there is a very good morphology. But nobody is going to ask you a morphology of a squamous cell carcinoma, morphology of a basal cell carcinoma or a leiomyoma. Where exactly it is applicable, you people should know and then read. Interpretation, any of the forms of biopsies, etc. we had mentioned. Differential diagnosis. Giant cell lesion is an example. Like that, there are very many. You should choose the questions and you should put that in a particular section where all you will be having this. Complications, for example, myocardial infarction. There are a good number of complications which you people should be knowing. Columns, wherever it is required. Antemortem and postmortem plot. Antithrombotic and thrombotic factors. If the shoe fits, buy it. If you find one particular source as a good source for a particular question, you will have to deploy it. Make use of it. A nice saying. Again, a word of caution, short notes can be essays, essays can be short notes. Part of essays can be asked as short notes. These are all questions, lipoid nephrosis, IgA nephropathy, end-stage kidney, etc. All short notes. But then you can also get a question of interpretation of renal biopsy, wherein you will have to add all the factual details of these things also. And always remember, when lipoid nephrosis is a question, it doesn't mean that you should not be asked membranoproliferative disorder. Therefore, when one is asked, you'll have to read the rest. Air embolism is a question. That doesn't mean fat embolism should not be asked. Once embolism is a question, you will have to read the entire lot of it. There are some differences. I concentrate on the exam usually. And in the exam, there should be a time management. There should be a time management in writing the exam, reading the exam. And you will have to know something about everything. You will have to read, recite, reproduce, and recollect. And these should also be for answering in the Viva. You will have to read it thoroughly because in the Viva there is a different thing, but then it will be based on this knowledge. There are seminars, symposium, workshops, etc. All will say you will be having to attend all these things, you will have to go to the workshops, etc. But there are certain things which are useful for us. They will be providing some material. Please make use of those handouts. File them, read from them. And otherwise, all this will become a source of knowledge with which you can give guest lectures at a later date after passing the exam, not much during the examination. And as I told you people, the question paper. This is a couple of question paper that I have got from the MGR Medical University. Look at this one. Problem-based questions are being asked. So there might be a chance that different universities are asking it or different paper setters might be asking it. We shall be just prepared for it. But my thing is different. Look at this one. You may get complicated questions like endoscopic biopsies, etc. Or nephritic syndrome. The nephritic syndrome itself is an undergraduate question. So that is what I had been telling you people. If you read the undergraduate questions, a good number of your portions will be covered. But then you will have to read it up to the postgraduate level and keep adding the points so that your answer is subsequently easy. Otherwise, you try doing this, take an undergraduate question, locate it in your Robbins, tear off that page. So keep on tearing the undergraduate question, see how much of Robbins is going to be left behind. But any of those can be asked as questions for us. For example, Crohn's disease. All of us know it is an age-old question for us. So these questions can be asked a good number. Sometimes it looks like an undergraduate paper itself. So please do be prepared for questions like this. This is another paper. Look at this again. If you had read your Robbins and Ackerman, you people will be able to write this straight away. Classification of the tumors, morphology, histology, etc. Maybe you will have to add the immunohistochemistry and the later molecular method of classification, etc. Classify jaundice. This is something that we might very well forget, and even otherwise our answer will not be that good. Always it is said that a student who prepares question wise answers better. And take it from me, if you read the questions continuously, the entire book will be covered. There is also an important message. Look at this again, ulcerative colitis. When Crohn's disease is asked, it is my business to read ulcerative colitis. Aneurysm of the brain. Aneurysm is an undergraduate question. So I will have to read it to the level of the postgraduate. But this particular slide is for showing you this only. We have been harassed by this COVID virus. So look at the question over here, and it is November 2021, where they have asked viral inclusions, role of PCR in a diagnostic laboratory. Both are obviously linked to this. So if there is any happening like that, I would like you people to kindly concentrate and read all the related topics. Viral inclusions, viral hepatitis, all can be asked as questions. So this is one. And I'm coming to the end of the session. This is what we call as OSPE. This is usually a part of the practical examination. But what I'm trying to say is, this is a chart of the Tay-Sachs disease that we have got. Similarly, you people will be having a number of charts or OSPE stations in your college. Please read the theory part of it continuously so that you answer it as a theory question. And you find that there will be a lot of overlap. SLE will be asked in practicals, SLE will be asked in theory. Tay-Sachs disease can come as a short note, or inclusion diseases or lysosomal disorders can be asked as a question for us. So kindly, please do it, and any of these can be asked as questions for us. So please be prepared for that. So this is one of my last slides. So what we are passing through, it looks like a tunnel. And I always advise my students, when you are passing through such a dark tunnel, there will always be a light at the end of it. Please do not turn back. It will be horrifying. Never turn back. Look at the brightness that is staring at you. To be continued. Thank you.